Good afternoon, everybody, and welcome, and thank you for coming today. I'd like to, before we get started, I'd like to just introduce a few folks so that you know who's here. Starting with, and I don't know where she went to. Maybe I'm missing Betty. Are you?
Betty's right there.
I'm right here.
Oh, there you are, Betty. Betty Lapp, the chairman of the board at United Memorial Medical Center. Donna Thompson and Dr. Barry Rosenberg, two of our board members at United Memorial Medical Center. I'd also like to introduce Mark Clement, the CEO and president of Rochester General Hospital, and Bob Doby's the chairman of the Rochester General Health System, and Bob Doby's the chairman of the board of Rochester General Health System, and also Anna Lamb, who is the president of our medical staff here at United Memorial Medical Center. So as we look forward, and we look back, United Memorial Medical Center has traced its roots to a group of community-minded women that started the first hospital in Genesee County over 102 years ago, and then shortly followed by a second hospital started by the Sisters of Mercy in Genesee County. And over the past 100 years, we've developed a robust healthcare organization through careful planning, but also through a willingness to change. And that is a tradition that is continuing today. Healthcare reform and market forces have challenged all healthcare organizations, but in particular, small community hospitals are facing increasing stress. Several months ago, we began a strategic process which included an assessment of the expected impact on United Memorial Medical Center over the next 5 years and beyond. That assessment showed that today we're operationally, clinically, and financially strong, and we could survive over the short term, but that's not our objective. Our objective is to grow and to thrive and to continue to be a cornerstone of service that our community depends on. Therefore, the best course of action for our organization is to find a strategic partner, and the imperative is to try to find that partner sooner rather than later. We have conducted a due diligence analysis and assessed several potential partners looking for a proven track record, similar organizational culture, and a dedication to locally delivered care. Today, on behalf of the United Memorial Medical Center Board of Directors, I am pleased to share with you that the board has unanimously approved a plan for United Memorial Medical Center to join Rochester General Health System. This is the right system for UMC. We have a long history of clinical collaboration, and our growing affiliation with Rochester General includes services such as cardiology, gastroenterology, pathology, general surgery, tele-ICU support, and most recently we partnered to open a cancer infusion center right here at UMC, providing world-class cancer care to our residents. All are examples of success, which demonstrates how together we have been able to bring specialized quality services to where our patients are comfortable right at home. Our leadership team and board chose RGHS because of its proven track record for helping affiliated hospitals pursue their community-centered missions. We were impressed with the investment and service expansion that have helped make Newark Wayne Community Hospital so successful, as well as seamless access to highly specialized services at Rochester General when patients need it. That, coupled with RGH's outstanding reputation for quality and service, made RGHS the clear choice for United Memorial Medical Center. United Memorial will continue to be a full-service acute care hospital servicing Genesee County, with access to progressive technology and expertise that keeps us at the forefront of providing high-quality care right here in Genesee County. And by integrating with RGHS, our patients will have immediate, seamless access to world-class, complex, specialized services within minutes when necessary, including the Rochester General SANS Constellation Heart Institute, ranked first in New York for cardiac care for several years. We are excited about what this alliance means for our clinical staff, for our team members, but most importantly for our community and for our patients. At a time when rural health systems are struggling, we will grow and strengthen healthcare services in Genesee County. We are excited about our shared vision for increased services, improved access to specialists, and a viable business model that will keep United Memorial serving Genesee County for a long, long time. Thank you. And now I'd like to introduce Mark Clement, the President and CEO of Rochester General, to say a few words.
Thank you very much, Mark, and good afternoon to all of you. I want to thank you for joining us for this exciting announcement this afternoon, and in particular for braving the weather to join us. It was an interesting drive from Rochester to Batavia just a moment ago. I'd like to again join Mark in extending a special thanks to the board members and the board leaders who are with us today from our two organizations, from United Memorial Medical Center and Rochester General Health System. Betty Lapp, the chair of the United Memorial Medical Center, and Bob Dobies, chair of the Rochester General Health System Board. You know, on behalf of the Rochester General Health System Board, our medical staff, our more than 8,000 team members, we refer to our employees as team members, I want to say how excited we are to announce this logical next step in our more than 5-year growing relationship with the United Memorial Medical Center, a partnership that will expand access and strengthen health care for the residents of Genesee County today and in the months and years to come. Since 2008, we have collaborated with Mark and his team and the medical community here in Batavia to bring nationally recognized cardiology, as Mark has indicated, cardiology, pathology, urology, surgery, critical care, and gastroenterology services to Genesee County. And most recently, together, we've opened the new Cancer and Infusion Center right here at United Memorial Medical Center. Our formal affiliation will lead to a continued expansion of healthcare services in the Genesee County area. And over time, this partnership will result in fewer residents of this community needing to leave their homes, their community, their neighborhoods to receive vital health care services. Our affiliation with United Memorial Medical Center will be similar to the highly successful partnership with Newark Wayne Community Hospital in Wayne County that Mark referenced just a moment ago. And our planned partnership and affiliation that we announced about 4 months ago with Clifton Springs Hospital and Clinic in Ontario County. With this affiliation, we achieve our system, Rochester General Health System, achieves another important milestone in creating a model regional healthcare system of the future, a system that provides convenient and timely access to a full range of Rochester General's nationally recognized healthcare services to help patients get healthy and stay healthy right in their own hometown communities. And our planned affiliation with United Memorial Medical Center will complement and enhance Rochester General's current merger plans with Unity Health System, which we announced about 10 months ago. With United Memorial Hospital and Medical Center and soon Clifton Springs as part of Rochester General Health System. The new organization we are building with Unity will have 5 high-quality integrated hospitals serving the residents of Monroe, Ontario, Wayne, and Genesee counties, allowing our new system to conveniently serve more than 1 million residents. Our new system will be positioned to not only deliver world-class cures for disease and illness, but just as importantly, we will be able to serve as a regional and national leader in preventing illness, most importantly, preventing illness and improving the health of the communities we serve. You know, at a time when healthcare reform, as Mark spoke, reimbursement cuts, increased specialization and dependency on expensive, sophisticated technology are threatening the future stability of rural healthcare organizations, we are excited to formalize and deepen our relationship with United Memorial to help it to grow and to help it to thrive and ultimately to continue its journey to become the most trusted healthcare provider for the residents of Genesee and surrounding counties. We are committed to working with United Memorial to bring new technology, specialized services, care management, clinical informatics, and other resources to bear for both patients and physicians in order to truly enable this community to maintain and improve its health. With similar patient-centered cultures, our two organizations share a vision to build on an already strong reputation that United Memorial and its physicians enjoy in Genesee County, to enable them to become the preferred Western destination for our full-service continuum of nationally recognized healthcare services. Together, we can create the best of both worlds for our patients. First, we can offer convenient, local access to the complete and growing range of clinical and specialty services made available through a combination of full-time, on-site clinical staff and facilities, traveling specialists, and satellite offices, as well as telemedicine. And secondly, when a level of care is needed above that which is typically found in a rural community, we can offer and will offer patients immediate and oftentimes life-saving access to highly specialized physicians and services ranging from cardiac surgery, as Mark referenced, to complex neurosurgery, stroke, and critical care, among many others. All available from the system's tertiary care hub at Rochester General Hospital. This will bring the residents and patients of Genesee County valuable peace of mind knowing that on any day and in any moment, the absolute best path to care, whether for a routine physical, ongoing specialized treatments, or emergent life-saving procedures, will always start right here in your own community at United Memorial, just minutes away. So what does this partnership really mean to the residents of Genesee County? You know, it can mean, and we believe it will mean, the difference between life and death, between total reassurance and anguish. You know, our 20-year affiliation with Newark Wayne Community Hospital provides great examples of the very personal and human impact that the partnership that we are announcing today will have on the residents and patients living within Genesee County. One particularly compelling and recent example is Kate's story. Kate currently lives in Wayne County with her husband John and 5 young children. In late August of last year, just a couple of months after giving birth to Kate's youngest son, Elijah, Kate started experiencing pains in her chest, so her husband John drove her to her physician. While en route to her doctor, Kate lost consciousness, so John took her straight to the emergency department at Newark Wayne Community Hospital, where physicians immediately determined that Kate had suffered a massive heart attack. Lucky for Kate, Newark Wayne was no longer a standalone rural hospital. It was now a fully integrated Rochester General Health System affiliated hospital that happens to be in her local community. Same doctors, same staff, same clinical protocols, same electronic patient record system, same standards of care as you would find at Rochester General Hospital, except all in Kate's local community, much closer to home. From the minute she arrived in the Newark Wayne Community Hospital Emergency Department, Kate's care was expertly managed by one tightly integrated, world-class team that included top cardiac specialists in the state. As Mark had referenced, the Rochester General Hospital cardiac program has consistently been recognized as the #1 provider of cardiac services in the state, based upon publicly reported quality and patient safety data. You know, through the use of advanced technology, these specialists at Rochester General were able to view Kate's medical record, monitor her hemodynamic status, and collaborate with their colleagues at Newark Wayne Community Hospital to stabilize Kate while arranging her immediate Mercy flight airlift to the cardiac cath lab at Rochester General Hospital. The highly specialized care that Kate required is simply not available in most community hospitals, no matter how good those community hospitals are. And time matters. This rapid diagnosis, capable clinical management, and immediate transfer to an affiliated facility that could provide the specialized care needed literally meant the difference between life and death for Kate. Kate ended up in the cardiac catheterization laboratory in record time, in less than 20 minutes after being diagnosed and stabilized at Newark Wayne Community Hospital. And once arriving at Rochester General Hospital, she was diagnosed in the cath lab with a totally blocked front main heart artery. Kate spent just over an hour in the cardiac catheterization laboratory at Rochester General, having the life-saving procedure which was required to remove the blockage from her artery and restore normal blood flow, all while she remained unconscious. This was followed by 2 days spent in the medical ICU, where she was placed on state-of-the-art hypothermia protocol necessary to help her brain and body heal, a protocol that's only available in top hospitals around the country. Today, I am extremely proud to share that Kate has fully recovered, returning to her active life and many rewarding roles as mother, wife, daughter, and granddaughter. She also happens to be here with us today. Kate, can you please stand? This is Kate. Thank you, Kate. Thank you, Kate, for allowing me to tell this story. Kate, what a joy it is to have you with us today, and what an honor it was for our team of physicians and nurses collaborating seamlessly across 2 counties, many miles, to provide you with the full range of life-saving care you needed, starting the minute you came through the doors of your own community hospital. Your story brings to life in words that I couldn't find and that I could never express. Your story brings to life and makes real how the partnership we are announcing today with United Memorial Medical Center does matter, and how it will make a real difference in the lives of Genesee County residents, just as it has made a real difference in your life and the life of your family. Kate's happy ending is an inspiring example of how healthcare should be here and how healthcare should be in every community. We look forward to our partnership with United Memorial to help bring this innovative model of exceptional care right to the doorsteps of Genesee County residents for many years to come. I thank you all for being with us today and allowing us to share this exciting announcement with you.